The chat is also open. I'm going to hold off on giving people privileges to come off mute. We can save that for the end, but the chat feature is open. If you do have questions, please feel free to post them in the chat, but we will have a designated Q&A at the end of the presentation. So if you want to hold off on asking your questions till then please, by all means, post them into the chat. So from here, what I'll do is I'm going to hand it off to Megan. Thank you, and both you and Dr. Rollins for coming tonight and chatting with us here at WGU.
You bet. Thank you. Hi, everyone. I'm Megan Haverkamp, and I am an outreach specialist here with the Princeton Review. And I have been, close to 16, 17 years helping students and individuals pass high stakes exams. We can go to the next slide. Before we get started on understanding the NCLEX, I am going to tell you a little bit about Princeton Review and some of the products we have for test prep for the NCLEX. So Princeton Review has been helping students prepare for high stakes exams for over 40 years. Some of you might know or have heard of us when you were in high school with test prep for SAT and ACT, but we have recently reached into doing test prep for professional licensure like the NCLEX. So the NCLEX, we have two wonderful products that can help you study and improve your scores and pass the exam with the NCLEX. The first product we have is a Q bank. Our question bank is subscription style. You can access it for 30 days, 90 days, or for a year. There are over 3,500 questions. 1,920 of those are directly from the NCSBN's prior test bank. And each question has full explanations, why you got it right, why you got it wrong. With our 90-day subscription and our year subscription, you get 2 tests that you can take that give you a full score report detailing where your weaknesses and strengths are, along with online flashcards. Our 30-day has one of those exams. The next product we have is really a more enhanced way of studying, and that is our live online. Our live online classes are over 18 hours of expert instruction. They are 2-hour-long or 3-hour-long classes twice a week for 3 weeks. And we run those during the evenings, during the week, and we do have some weekend classes in the morning as well. You will have a year's subscription to the Q Bank as well, and along with the assessments as well. But the benefit of being in a live class is really you get the expert instruction, you get to ask questions of our instructors, you get their contact information to send them questions while you're in the class. You also get the benefit of being in a class, which sometimes helps, asking questions. Sometimes your neighbor asks a question that, you were thinking of but didn't ask. So really, it's a little more structured to studying. And so those are our 2 products, Live Online and the Q Bank. You can definitely get more information. Right there is a QR code, as well as you can visit our website at princetonreview.com. Before we get started, just a few housekeeping things. you definitely can put your questions in the chat. If we do not get to them, I will be sure to get those answered for you and get them back to RJ so he can send them to you. The second thing I just want to say is today's presentation is on the NCLEX. We are very aware of the changes coming in April with Next Gen. But today we're going to concentrate on, on NCLEX and not the new Next Gen item questions. As most of you know, only about the content is not changing. Only about 10% of questions are changing, and it's really how those questions are asked and the style in which the examiners are going to present those to you. And we will have another presentation on the next gen questions and question types and how to attack those. Once we get closer to April, this is really for anyone that's jumping in right now. But for those of you that are also going to take the exam in April, this is still very relevant content for you to go over. And with that, I will jump into what we're here for, understanding the NCLEX. And I'd like to introduce Dr. Ebony Rollins. She is a nursing educator and clinician who harnesses her years of nursing experience to bring a unique skill set to her teaching. Her experience as an advanced practice nurse allows her to engage with students in dynamic ways. She has educated nursing graduates and nurses across various settings for many years and enjoys helping nurses connect their caring nature and clinical skills. And with that, I will turn it over to Dr. Rollins.
Thank you so much, Megan. Good evening, everyone. Excuse me. My name is Dr. Ebony Rollins, and I am going to go through the presentation with you. And what we're going to talk about is how we can better understand the NCLEX. So for this presentation, as she stated, we're only going to talk about the current exam. Again, we are aware of the next gen standards that are coming, but if you are looking to test in the near future, meaning the next 2 weeks, 4 weeks, before that change comes, this is definitely information that will be relevant to you right now. And even those that will be testing later, again, this will still be some great information for you. So we're first going to definitely get into what the NCLEX actually is to make sure that we understand that a little bit better. So the NCLEX is going to be making sure that you are ready for entry-level practice. So that's why it's regulated by the NCSBN, because they are looking to make sure that you are ready to enter practice at a basic level. Now, this exam runs all throughout the year, and it is a pass or fail exam. So when we start talking about the NCLEX, people often want to know, what their score is. It's a pass or fail exam. So when we start looking at what the NCBSN is looking for, that's what we're going to talk about in the presentation this evening. So the NCLEX is designed to test your ability to think like a nurse, to think like a person who has been trained with the basic knowledge and skill level to perform, nursing services. So it's significantly different from the test that you take in your nursing program. So nursing school exams are often knowledge-based for the specific content that you were giving during a specific time. So your exam 1 may be over modules 1, 2, and 3, and then your exam 2 over modules 4, 5, and 6, that type of thing. The NCLEX is a conclusive exam, so it's a cumulative exam, so to speak. I tell people to think of it like a cumulative final in your nursing school, because that's what it kind of presents like. You need to be able to consider application. You need to be able to consider how you can apply knowledge, and you will be tested to see how well you can use your critical thinking and use your nursing judgment. And again, it's only testing your ability to think like a nurse, not to think like a doctor, not to think like a respiratory therapist or think like some other healthcare partner that you may be working with, but it's only checking to see your knowledge base as a nurse. So what we're going to do is we're going to talk about the client need categories and activity statements and how that unfolds for you on the NCLEX. And we're going to talk about how the exam is comprised. So here are your client need categories. So safe and effective care environment, that consists of 2 statements, which is the management of care, safety and infection control. And as you can see, your management of care is 17 to 23% of your total exam. So that's going to be really important. Your safety and infection control, 9 to 15%, still a really good bulk of the exam. And then your second section is going to be your health promotion and maintenance. That will make up 6 to 12% of your exam. Your psychological integrity is 6 to 12% as well. And then your physiological integrity is broken down into 4 separate areas. So this is also a large portion of your exam. So your basic care and comfort, your pharmacological and parenteral therapies, which is going to be your drug therapies, your reduction of risk potential, and then your physiological adaptation. So these are all of the percentages of those sections of the exam. So as you can see, section 1 and section 4 are going to be the bulk of your exam. So what we're going to do in this presentation, we are going to look at these client need categories, and this is a part of what we do at the Princeton Review to help you glean a better understanding of what this may look like on your exam. So I want to point out that there is no time limit set per section. It's only a percentage of questions. So there's not a certain amount of time that you're allowed to spend in a section. The test takers for the NCLEX, you have a total of 5 hours. You want to understand that your designated breaks are included in there. You'll get your first break after the 2-hour mark. That will be an automatic break. It will tell you to take a break. And then after that, you can ask for a break. Keep in mind that the minimum number of questions is still 75, with 15 of those questions being experimental. So you're only going to get scored 60 questions. The maximum number of questions is 265, and that has not changed. So that is how your NCLEX will be presented question-wise. And then here are your percentages of your client need categories. So we are going to go through and look at the activity statements, and we're going to look at the client need categories. We're going to have some sample questions so that you guys can answer them with me. And then finally, when we get to the end, we are going to talk about individual preparation plans, and then we will do some question and answer. So we will go ahead and get started with the activity statements. So when we start talking about activity statements, we're talking about your ability to use your knowledge base and identify what's expected for new graduates in the area of nursing. This is developed through survey analysis. They look at experienced bedside nurses, nurse managers, nurse educators, and other stakeholders. And other stakeholders are hospitals, nursing schools, nurse educators that are not currently educating but may have retired. So it's looking from all populations and trying to figure out what's the best way to test nurses. And that's how these activity statements are presented through the NCSBN. The main thing you need to understand is that you need to be able to apply your clinical reasoning, your clinical decision making, and your clinical judgment. So you need to be able to rely on the things that you've learned and be able to put them together in order to answer the questions properly. So the first thing we're going to look at is the integrated processes of making up the questions. So you have your fundamentals of nursing practice, and this often can be a little bit intimidating for some students because you learn fundamentals in the beginning of nursing school, and then you learn so many things after that that sometimes you feel like these are things that you have forgotten, or you're not as fresh, they're not as fresh in your memory, but you will remember them when the questions are presented to you. So you always want to remember your nursing process. We know that that looks like your assessment, your diagnosis, your planning, implementation, and then your evaluation. Those are all things that are considered the basis of the nursing process. We want to look at communication and documentation. Those things are very important, especially with the integration of the electronic health record. We want to look at caring, teaching and learning, and definitely looking at culture and spirituality. It's very important to make sure you have a basic knowledge base of certain cultures and spiritual practices when you are studying for your NCLEX, because you will be expected to honor and be expected to take into consideration certain cultures and spiritual practices of your clients that you're going to be caring for. So when we start talking about the integrated processes of the NCLEX, this is what we're going to be looking at. So these 5 areas right here are going to be integrated into your client need categories and into your questions. So we're first going to start off with management of care. So what does management of care look like? So it looks like when you are providing direct nursing care. So this is where you are promoting a team-based approach, because we know that nursing and caring for people is very interdisciplinary. This looks like care coordination with your case manager, your physical therapist, your speech therapist, the doctor, nurse practitioner, physician's assistant, whomever you may be working with to care for the patient. And this is considered a patient-centered approach when we talk about management of care. So you want to make sure that you are thinking about advocacy for your patients, making sure you understand that in your state, what can be delegated, what needs supervision, looking at the client rights, and making sure you are able to establish priorities when you're thinking about care for your patients. So the management of care sector is extremely big because it can involve any section of the NCLEX, because everything you do is going to be working to manage the care of the client, even their families, their loved ones. It could be their caregivers. So this is a big portion of the test, because this would be a big portion of the care that you're going to be expected to provide. So looking at this, we're going to now go in and look at a question that you might see from the management of care category. So I'm not going to be able to see the chat, but if Megan can watch the chat and look for any answers you type in, I would appreciate that. So this is the question we're going to look at. The nurse is reviewing the discharge plans for assigned clients. Which client should the nurse request a prescription for skilled nursing home care? So remember, we're thinking about management of care. Okay, so A, the client who has cancer and is weak from chemotherapy. B, the client with an infection and requires IV antibiotics. C, the client who had knee surgery and is walking with crutches. Or D, the client with dementia and needs assistance with meals. So who do we think needs a request for skilled nursing home care? So which one of these clients may have a issue with caring for themselves at home, and it may not be suspected? Oh, so I can see the chat. I see Kelly said D. Anybody else type anything there? Okay. Shelly says D. Okay, so you guys are correct. The answer is D. So the client with dementia needs assistance with meals. Why? Because we don't want this person at home trying to cook for themselves. They may start a fire, they may burn themselves. Many other things can happen. So sometimes people are able to pick out the correct answers, but we also want to talk about why the other answers are not correct. In this case, the client who had knee surgery is walking with crutches. So they're already progressed in their rehab so that they can walk with crutches. So they have a good idea of what their expectation is in terms of their mobility. So the client that has an infection and requires IV antibiotics, we know that with IV antibiotics, they either need to have a specific set of issues to do that at home, or the person is automatically sent out to the home. The nurse wouldn't need to request this. This would already be something that's done. The client who has cancer and is weak from chemotherapy, this is something that the nurse can discuss with the family. If the family is able to care for this patient at home, they may not need skilled nursing home care. But a client that has dementia really shouldn't be left at home to cook for themselves. So the correct answer would be D. All right, so the next thing we're going to go to is safety and infection control. So this is where you're expected to protect the client and their health and the healthcare personnel. So you can't forget about yourself and your coworkers when you're talking about safety and infection control. So we want to think about preventing errors and accidents, thinking about home safety, safe use of equipment, standard precautions, surgical asepsis, restraints, and safety devices. So these are all things concerned with safety and infection control. When we think about infection control, we also need to think about things that we may not have considered before in terms of, you know, different allergies to certain use of things like masks and gloves and things of that nature. So all of those things are a part of the safety and infection control. So in this category, you can often get questions related to education. So how would you educate the person on their discharge? How would you educate their family members? Would you need to work and discuss care coordination for the patient so you can make sure that they are free from error or accident at home, making sure the patient or client and their family can return demonstration for you when you show them how to use a walker or a cane or any sort of assistive device. So all of those questions are in this category. So our question is, the nurse is providing care to a client with chronic constipation. The client is on neutropenic precautions. Which prescription should the nurse clarify? A high fiber diet. B, an abdominal x-ray. C, digital disimpaction. Or D, ambulate ad lib. So what do you guys think would be the correct answer here? So A, I saw someone say A. Anybody else? A, okay, a high fiber diet. Anybody else want to guess? All right. So let's read the question again. The nurse is providing care to a client with chronic constipation. The client is on neutropenic precautions. Which prescription should the nurse clarify? So a high fiber diet. We know that people who struggle with constipation, we often recommend that they eat a high fiber diet, right? So I'm not sure why the nurse would need to clarify this. A lot of times people think it's because of the neutropenic precautions. But let's talk about neutropenic precautions. So that is what you would need to know in the stem of the question to be able to answer this question. So people become neutropenic after chemo, radiation, even after they're given certain medications. And the goal of neutropenic precautions is to keep the person away from germs and bugs and things of that nature. Now, when someone becomes neutropenic, what is also common knowledge is that their rectal area is extremely sensitive. They're not given enemas, they're not giving suppositories, and we should not be digitally disimpacting people that are neutropenic because oftentimes it causes a tear in their rectum. So the nurse should clarify C actually. They should clarify the need for digital disimpaction because that is not something that you typically do with neutropenic patients. It's honestly not something we do very much with any patients because it's very uncomfortable and oftentimes leads to hemorrhoids after or bleeding. So digital disimpaction is what you want to clarify. Why does the patient need this? Did we try other things already that could help with the chronic constipation? Because what you also want to remember is that it tells you that this is a chronic problem. This is not an acute problem for the patient. So because it's chronic, even the patient may be able to provide you with some suggestions with what they do at home. We always want to take those things into consideration. Why the digital disimpaction? Why do we need to question that? Again, we're talking about safety and infection control. Would we really be controlling infection by digitally disimpacting the patient? Probably not. There's a risk that you could have, the glove could rip and you could get feces on your hand. There, you could give the patient an infection. So that is something that you should definitely clarify with the provider. So in this question, you would need to understand that the problem is chronic and you would need to understand what neutropenic precautions are. Okay? So the next category we're going to look at is health promotion and maintenance. Now, this category is also very broad, and in a nutshell, this category is the way that the nurse is going to help the client achieve their optimal health. So in this section, you may be asked to identify the client's strengths and their weaknesses so that you can help them, build on their strengths and improve their weaknesses. So you will often see questions about the aging process, antepartum, intrapartum, and postpartum care, newborn care, things like health promotion, health screenings, where we talk about primary, secondary, and tertiary screenings, high-risk behaviors, when we talk about safe sex practices, STIs, STDs, lifestyle choices, physical activity, and also just simple physical assessment. So reminding patients to check their skin after they've been out in the sun, reminding them to wear sunscreen, talking about newborn care with a new mom for the first time. So that is what this section is about. So your health promotion and maintenance. I will tell you that this is where you will see a lot of your pediatric questions tailored around your health promotion and maintenance. So being able to recognize and identify the levels of development in children is going to be extremely important for you. And so when we think about health promotion and maintenance, we need to be able to know and identify if a child is possibly developmentally delayed, so we can bring that to the attention of the provider that's taking care of the patient. So let's look at our question here. All right, so the nurse is caring for a 16-month-old client at a well visit. So in this stem of the question, we need to understand that the baby is not sick and that they're 16-month-old. So this is a well visit. Which of the following findings is expected for the client's developmental level? So here again, you would need to know and understand what's expected developmentally of children. So at 16 months old, would the child be able to open a door by turning a knob, speaking in 3-word sentences, walking upstairs unassisted, or scribbling with a crayon? So you guys let me know what you think here. So at 16 months old, what is expected? Okay, I see someone said D. Anybody else? So should this child be able to open a door by turning a knob, speak in 3-word sentences, walk upstairs unassisted, or scribbling with a crayon? Okay, so I see an A, I see D again. So here the answer actually is B. A 16-month-old is expected to be able to speak in 3-word sentences. So opening a door by turning a knob requires hand-eye coordination. A 16-month-old is not going to have the hand-eye coordination or the dexterity to open the door by turning a knob. Walking upstairs, they could walk upstairs, but they couldn't do it unassisted. They would need someone to hold their hand to walk up the stairs. Again, scribbling with a crayon requires some dexterity, some really good hand-eye coordination, which a 16-month-old is not quite going to have. Now, what you're going to expect generally from a 16-month-old is they'll be able to walk well. They'll be able to, hear music and start to dance. They'll be able to climb. They'll be able to run a short distance without falling, because when they try to run for a long distance, they tend to lose their balance. You will also see that a 16-month-old probably will pick up a crayon, but they will likely take it to their mouth first and not to a piece of paper. They will start to mimic the words that they hear. So they will likely be able to speak in 3-word sentences, because now they're starting to develop some speech. So speaking in 3 words is what's developmentally expected for this client's developmental level. So again, in this section, you want to make sure that you are clear about the developmental stages and what's expected and what's unexpected. Now, you will always have outliers. You will always have children that are a little bit more advanced and able to do things that are outside of their level, but that is not what they're going to be testing you on. You're going to be tested on what is expected, or you may be tested on what is a concern if a child is not able to do something. So you want to get familiar there. All right, so psychosocial integrity. So this section can be very, very broad as well, because we're going to be talking about, this is where the nurse is concerned with emotional, mental, and social well-being of their client. So clients that may experience acute and chronic diseases in terms of mental health, if there's any abuse or neglect, crisis intervention, this is where you will look at cultural awareness and influence, end-of-life care, mental health concepts, and then substance abuse and disorders. So this section talks about making sure someone is basically healthy in a whole way in all aspects. So emotional, mentally, and their social well-being, because we know that all of those things can affect someone's health. And this can be caused by an acute event or a chronic exacerbation of a disease. So our question here is, the nurse is caring for a client who is experiencing, I'm sorry, don't know why it's moving back and forth. There you go. The nurse is caring for a client who is experiencing an acute phase of schizophrenia and is exhibiting positive symptoms. Which finding should the nurse expect to observe? So what you're going to need to understand here is that this is an acute phase of schizophrenia and that the client is experiencing positive symptoms. Because if you are aware of schizophrenia, there are positive symptoms and there are negative symptoms. So this is telling you that the client is in an acute phase and they are exhibiting positive symptoms. So which finding should the nurse expect to see? A, the client reports the call bell as a tracking device. B, the client avoids eye contact. C, the client refuses to get out of bed. D, the client has difficulty with eating. So what do you guys think is the one that the nurse should expect to observe? Okay, I see an A there. A. Okay. All right, so A is correct. The client reports that the call bell is a tracking device. This is a positive symptom of acute schizophrenia. Now, B, C, and D are all negative symptoms of acute schizophrenia. This is where the person is withdrawn. So they're still signs of schizophrenia, but they are considered negative symptoms. So a person could still be in their acute phase, but be having negative symptoms. So A is the option for positive symptoms. Great job. All right, so basic care and comfort is the next category that we're going to look at. So this is where the nurse is providing comfort and assistance for the client. This is where you deal with a lot of caregivers, you deal with performing ADLs, making sure they're done safely. You're looking at non-pharmacological measures. So what could you do for this client that only a nurse can do? So you don't need to call the doctor. You don't need to get permission. So a warm towel over the head for a headache. That's basic care and comfort, right? So that's what we're talking about in this section. We're talking about the safe use of assistive devices, making sure they can be mobile properly without risk of falls, looking at comfort measures, and this is also where you will get questions around postmortem care, okay? So this is all about super simple basics. So in this category, I often warn students that these are the questions that you tend to overthink because they are just like they sound. They're basic care and comfort. This is for the client and yourself as the nurse. It's for your unlicensed personnel, your CNA, your patient care tech that's working with you. This is basic care and comfort. And so these are the questions that students often overthink because they feel like the answer is just too simple, but you have to remember that we're talking about the basics. So let's look at the question for this section. So a nurse is preparing to transfer a client who has been on bed rest to a chair. Which action should the nurse take first? So when you see a question that asks you what action should you take first, we know that that likely means all of these actions are appropriate. But what should you do first? What is the very first thing you should do, right? A, place a transfer bed on the client. B, position the bed at an appropriate height. C, assist the client to a seated position. Or D, obtain orthostatic vital signs. So I see two B's there. Position the bed at an appropriate height. Anybody else? So A, a transfer belt. B, fix the height of the bed. C, assist the client to a seated position. Or D, obtain orthostatic vital signs. So what should we do first? And you guys that said B, you are absolutely correct. You need to position the bed at an appropriate height. You do not want to hurt yourself or hurt the client. So you want to make sure that that bed is positioned appropriately. Although this is a very simple task, oftentimes we forget it and we think that, oh, it automatically should be known to do that. But if you skip that and go on to the next step, you may cause harm to yourself or the client. So you don't want to skip that. You want to make sure you are lowering the bed, okay? So our next section is going to be pharmacological and parenteral therapies, and this is your medication questions. These are your drug questions, your blood products. We're talking about central venous access catheters, also talking about expected actions and outcomes of those medications, proper medication administration, pain management, and things like TPN. So this whole section is about medication administration. There is a list of common drugs that are asked about on the NCLEX. So drug classes and specific drugs, that list is actually posted on the NCSBN website. You can find it there, along with these client need categories that we're talking about. And I suggest that everyone take a look at that. So we will go to our question. So the nurse is caring for a client with osteomyelitis, and the client is receiving IV infusion of prescribed vancomycin. Which statement by the client would be a priority for the nurse to report to the healthcare provider? A, I feel some burning at the catheter site. B, I feel a little nauseous. C, I have ringing in my ears. Or D, I have a headache. So what should we report to the healthcare provider? Again, you have to remember that you probably need to do something about all of these things, but you don't need to report all of them to the healthcare provider. So what do we know about vancomycin? For any drug, you need to know and understand what the signs of toxicity are. So I see you guys putting C in the chat. You are absolutely correct. If the client reports that they have ringing in their ears, they may be headed to some toxicity. So you want to report that to the healthcare provider, and make sure that they are aware of that. That may prompt them to call the pharmacy and adjust the dose of the medication. And that is something that you would need their assistance to do. If there's some burning at the catheter site, you can simply check the IV site. If they're feeling a little nauseous, that's not uncommon with IV antibiotics. You can provide them some medication if it's ordered. If they have a headache, you can also provide them with some orders for some medication that's for headache. So absolutely correct. You should always report that ringing in the ears. Great. All right, so reduction of risk potential is just what it sounds like. So you reduce the likelihood that the client will develop a complication. It doesn't mean that you can always stop it, but it means that you will reduce the risk. And what this looks like is making sure that you are removing Foley catheters when it's time for them to come out, so that the patient does not have the potential for a urinary tract infection. You want to make sure that you are looking at changes in abnormalities and vital signs and being very alert and astute to them for patients that are at risk for sepsis, reviewing your lab values to make sure that you are aware, what is a serious issue with the lab value and what is not. So that is what this section is about on your NCLEX. And it's also more so about potential complications. So your questions here are going to be around, are you able to recognize a complication before it happens, or while the complication is happening, do you know what to do to intervene? That is what this section of questions are about. So in this section too, you will be expected to identify your lab values. And here we have listed the lab values that you are expected to know. So your ABG values, your cholesterol, creatinine, glucose, your glycosylated hemoglobin, which is your A1C, your hematocrit and hemoglobin, INR, platelets, potassium, PT, PTT, and APTT, your sodium and WBCs. These are all the lab values that are currently on the NCLEX. So these are the ones that you're expected to know. So our question, the nurse is caring for a client who is in second-degree heart block and reports some dizziness and shortness of breath. The nurse notes that the client's blood pressure is 90/40 and has a heart rate of 45. Which action should the nurse take? A, administer prescribed atropine. B, prepare for transcutaneous pacing. C, perform synchronized cardioversion. D, administer prescribed vasopressin. So in this question, you're going to have to be familiar with a few things. The first one is going to be heart block, a second-degree heart block. What's the difference between a first, second, and third-degree heart block? What are signs that the patient is getting worse? Is the dizziness and shortness of breath expected? Or is this a sign that they are having a complication? The last one is you're going to have to be familiar with atropine, vasopressin, transcutaneous pacing, and synchronized cardioversion. So what do you guys think? A, give the atropine. B, prepare for pacing. C, perform cardioversion. Or D, administer vasopressin. So this is a tricky question because we know that they use vasopressin and NCLEX and atropine as well. Transcutaneous pacing is also used, but not for this type of heart block. And then synchronized cardioversion is not something you would do as a nurse. So our answer here is actually going to be A, administer the prescribed atropine. Yes, Rebecca. Administer the prescribed atropine. Why are we going to give the atropine? Atropine works on the SA node in the heart muscle, and it stops that heart rate from dropping. It works on several different things. It works for hypersalivation, bronchial secretions as well, but it will definitely stop that heart rate from dropping. So you would administer the prescribed atropine. All right, so our last section here is the physiological adaptation. Now, this section is where you basically need to know and understand your body systems, know and understand your anatomy and physiology, and know your body systems, how they work, and when they are alerting you to alterations and changes. So this is where you will be looking at your fluid and electrolyte imbalances, hemodynamics, illness management, medical emergencies, and unexpected responses to therapy. So if you're giving someone a treatment, you need to know and understand what might happen if that treatment does not go well. Okay, so that is what this section is about. So this is our last question, and then we will talk about your individual plans. So the nurse is assessing a client with heart failure. What finding observed by the nurse would indicate a decrease in cardiac output? Crackles in the bilateral lungs, in the bilateral lung bases, hypoactive bowel sounds, jugular vein distension, or lower extremity edema. So in this question, you would need to understand heart failure and cardiac output. So what are indications of cardiac output when a person has heart failure? How do we know that that cardiac output is decreased when heart failure is present? So I see an A there, crackles in the bilateral lungs. Anybody else? So what would indicate a decrease in cardiac output? I see a D there. Okay, C. Okay, so you may see all of these things with heart failure. So, but that's not what the question is asking you. The question is asking you, what would indicate a decrease in cardiac output? So you would need to understand that a patient with heart failure, some of these things are going to be expected. We're really not going to be super surprised by crackles in the bilateral lung basis because they probably have some fluid overload and they need to be diuresed. Your hypoactive bowel sounds are also very common. Your lower extremity edema is sometimes seen in patients with heart failure, but lower extremity edema can also be seen in people that have circulatory problems. So people that have peripheral artery disease, people that have lymphedema, this is not always a sign of heart failure, but jugular vein distension is a direct correlation with cardiac output. It's a sign that the blood is backing up in the heart muscle. It's not going where it's supposed to go. So your jugular vein distension is going to indicate that there is a decrease in cardiac output. So the answer is C. So that is our last question. Thank you guys for your participation. I appreciate it. So when we talk about the individualized preparation plans at the Princeton Review, you want to make sure that you are reviewing the activity statements and the client need categories, and you want to make sure you are familiar with them. So are there any of these that you are completely unfamiliar with? If they are, you need to make sure this is where you are studying. I will tell you what one of the biggest mistakes is for students is you study things you already are comfortable with because it gives you a dopamine spike and it makes you feel really good and proud of yourself. And so you don't go study the things that you know you struggle with. And we want to do the opposite of that, okay? So you want to use the activity statements to guide your review of the concepts, right? Think about your medication. Think about your diagnostic testing and procedures. Think about diseases. What do you know about these things and what are you not so clear about, right? So what could they use to test your knowledge about the medication and drug classifications? You need to be thinking about that. You want to be thinking about what diagnoses and treatments are used for certain complications. What is the nurse's priority? What is your role in this scenario for the patient and the client? So when we talk about disease, activity statements do not focus on specific disease. It's the overall concepts of the disease. So you're not going to see specific diseases that are targeted. It's going to be, how do you care for a patient with this disease? What did this patient need in particular with this disease? So if you have a COPD patient or a diabetic patient, they're not going to ask you questions about what is diabetes. They're going to give you that information. They're going to tell you that the client is diabetic. And then the questions are going to be tied to, how do you care for a patient with diabetes? What are some specific things, education, medication administration that are particular to this person and their disease process? So that is what we try to help you do with the question bank and the live class at the Princeton Review. And the next thing we want to talk about is practice, practice, practice. Do your practice questions. I mean, the questions that are developed here at the Princeton Review, they are developed directly from the client need categories with the activity statements from the NCSBN. There is a huge variety of questions that we have, and they're not just based on certain systems or certain populations. We did a really, really intense and in-depth review of the questions to make sure that they had a great variety. And so that's why the question bank is highly, highly recommended, also in conjunction with the live course as well. So I think we can open up the floor to any questions that you guys might have. We have a few minutes. This is Megan's information here. If you have questions, you can email her at this specific email. And I think she's there.
Yep, I'm here.
There you go. Okay.
Does anyone have any questions for us before we close out I want to thank you guys all for coming and participating. Again, my information is here. If you have questions, just feel free to reach out. You can get more information about our products at princetonreview.com. I'll see if there's, oh.
Can I stop sharing? There we go.
Thank you.
And if anybody does have any questions, you can take yourself off mute and ask the question, or if you want to post it into the chat, feel free to do that as well.
So I'm really just starting. I'm in my second month of classes, third month, went so fast. And so I'm just wondering, like, how soon do you advise before the testing to start? Because I was going to buy a book today, and I was like, well, I don't know if it's too soon. Just like some of the questions, like, well, I haven't had any of these classes yet. So how soon would you recommend like starting to study?
You guys want me to answer that?
Sure, or
Okay.
go ahead.
So I will tell you that you don't want to overwhelm yourself with trying to study for the NCLEX before you learn the information. You need to make sure that you are focused on your current course content. We don't recommend that you start studying this early in your nursing school journey, mostly because number one, you're going to have to, and this is for any student, especially if this is like nursing is your second career or your second degree, you're going to have to completely figure out how you learn this information. So what you're going to want to focus on right now is study habits, the way that you learn best. Now is the time that you figure out if you're a visual learner, if you do better with videos, infographics, or do you do better with lectures or study groups? So in the beginning, you want to be tying down your study tactics. And we recommend starting to study for your NCLEX when you are about in that last or next to last semester. You will start to be able to develop that reasoning, that clinical reasoning that you're going to need to answer the questions. So don't overwhelm yourself. You have a lot ahead of you to get done, but the studying will come to you at the right time. But don't study too soon because you won't be able to answer the questions properly, and that just discourages you, and we don't want to do that.
Thank you so much, and thank you for your time.
You're welcome.
Thank you. Okay, so there's a question in the chat, and it looks like they're taking next gen because they're in their last semester now. So, and they want to, let's see, how is it different? So I can give you a general explanation on how it's different. And Ebony, please add anything you want to add as well. But the examiners are looking to really look at more of the critical thinking part of your answers and see if how better you can demonstrate that. And so they've added some new types of questions. And there are 5 or 6. It's an extended multiple choice, an extended drag and drop, a closed drop down, enhanced hotspot, and the matrix grid.
Yes. Mm-hmm.
So really these are multiple layer questions too. You'll be given a case study where you have the patient's information and then asked kind of the type of question. So it won't all be a direct multiple choice question. So it'll be more about how they're asking it. There's a little bit different scoring with those questions, and that's kind of a change. So it's not a straightforward multiple choice. You either get it right or wrong. It could be what are the two answers? And maybe you clicked one that's correct and one that's wrong. You might get partial credit for that. So that's kind of the extended multiple choice where you might have more option than one option. And we'll really dig into those. We can in another presentation. We are adding new next gen questions to our test bank as we speak. And we will continue to even once the exam comes out. But you will still see questions like this as well. The client need-based categories are not changing. And so it's still the same content. It's just how they're asking you and trying to glean how you will answer those questions. Are you really using clinical judgment and critical thinking in terms of not just guessing A, B, C, or D? Do you have anything to add, Dr. Rollins?
That was a great explanation. That is all of the main points. I do like to highlight that the partial credit is going to be something new, and they also are going to give you the lab values on the next gen NCLEX. So you don't have to, they won't be a part of what you have to remember. They will give you the pertinent lab value information in next gen. And I will tell you that it will adjust from completely critical thinking to actual clinical reasoning. Like, does it actually make sense that you would do this? And that's going to be the huge difference, because we know that critical thinking oftentimes makes us overthink. So they're going to test to make sure that you can use your clinical reasoning to make that judgment for the client. So that's one of the other big differences. But the client need categories, as she said, it's not going to change. Those activity statements are not changing.
Did I miss a question?
Fantastic. So we're at time, so I'm gonna stop the recording, and I want to say thank you for